All right, good morning, everybody, and welcome to the 23-24 school year. I can't tell you how nice it is to actually see your faces again. I hope you've had a good summer. I've really appreciated staying connected with some of you throughout the summer because I just really enjoy working with you and appreciate all the help you've been able to get or maintaining communications. But I also hope you've all had a chance to take a bit of a break because you certainly deserved one, at the end of the school year. So hopefully that all worked out well for you over the summer. So this is really our first school nurse meeting of the year, but it is really specific to school nurse corps nurses. So we wanted to have an opportunity to go over some of our, forms for the year to make sure that everybody had access to things and answer any questions people had before we get going for the year and start inviting the entire region of nurses to meetings. So this is just our group, and we do have some new people who are going to be on the line today, and we're going to have them take an opportunity to introduce themselves. So before they do that, we're going to start going through some material, but before we have them introduce themselves to you during this presentation, could you all who are experienced school nurses in your roles, could you take a minute to please introduce yourselves and which school you are at and maybe how long you've been a school nurse, so that Casey and Lena, who are new on the line today, can put your face with your name and know who you are, please. And let's go ahead and start. Michelle, do you want to start?
Okay, I'm Michelle Rogie. I'm at Manson, and this is year 12, school year 12.
Good. Ben?
I'm Ben Swartzel. I'm with Pascal Sherman Indian School, and this is going to be my third year.
Very good. Erica?
Hi, I'm Erica Scroggy. This will be my 10th year with the Chelan School District.
Very good. And it looks like Donna?
Donna and Amber. Hi. Hi.
And Amber. Hi.
Hi. So we took this job together last year. I've been in school nursing for many years over in Tacoma. And we job share, Amber and I. And go ahead. This is my second year as the nurse. I've subbed longer and I've been a nurse much longer. But yeah, here for a couple of years.
All right, great. Thank you so much. Nicole?
Hi, I'm Nicole from Brewster School District, and this is the start of my 5th school year being a school nurse.
Very good. And Debbie?
Hi, I'm Debbie Lawrence. I've been a school nurse, I think 12 years now, but this is the start of my 3rd year here in Washington.
Very good. Thank you. And Kelsey?
Hi, I'm Kelsey. This is the start of my 2nd year at Waterville, Indiana, and Palisades.
Very good. Thank you so much for joining. All right. And Sheila, could you introduce yourself so everybody knows who you are again?
Hi, I'm Sheila Salmon. I am the administrative assistant for the nursing program. And I've been at the ESD for 2 years.
Okay, very good. Now let's start with some other introductions. Casey, you're new to the group. Would you like to introduce yourself, please, and tell us a little about yourself?
Sure, yeah, I live in Chelan, and I'm going to do the Mansfield School District and then the Arando pre-K to 8.
All right, very good. And your nursing background is in what specialty?
Mainly emergency department. I travel nurse for 5 years and done a little bit of everything, but mainly ER.
Okay. See, when you're new, you have to embellish a little bit more and tell us a little bit more about yourself. So it can't be quite so short as everybody else's.
Short and sweet.
All right. Very good. Thank you so much. We're looking forward to having you at both of those schools. Very wonderful schools.
Thank you.
Hey, Kathy.
Yes.
She won't embellish on herself, so I will for her. So I've known Casey since nursing school. She's pretty amazing. She's a travel nurse. She's on top of things. Don't shake your head at me. She's she's going to be a great addition, and she just really knows her stuff. So I'm glad she took the job.
All right. Very nice. Thank you so much. All right, well, with that, we expect great things from you, Casey. So, you know,
Thanks,
you
Erica.
have to come through for us now. All right, next I want to introduce Lena Kate. So Lena has just joined North Central ESD, and she has joined as a position of team leader. And we're going to talk a little bit about her job this morning and what she'll be working on. But Lena, would you like to introduce yourself to the group, please?
Sure. Sorry, we have that's fun. Okay. My name's Lena Kate. Like Kathy said, I have spent my school nursing career over in the Yakima School District, and was with them for almost 11 school years now. So I've been a school nurse for a while and absolutely love it. So those of you that have been in school nursing for a while, I'm sure you can relate to all of the crazy things that happen during a school year, but keeps you on your toes for sure. So I'm really looking forward to taking a role of being supportive and helping you guys out. So I'm excited.
Yes, we're excited as well. So we'll talk a little bit more about that role later. Nicole, I see Nicole, you're on the line. Would you like to introduce yourself? She may have stepped away. Jody, would you like to introduce yourself to the group, please? Oh, you're on mute.
Hi, I'm Jody. I'm the school nurse for Soap Lake. Sorry I'm a little bit late. I was teaching hallway etiquette this morning.
That's okay. And how many years, Jody, now is this for you in your role?
This is my third year. My first year I came in November. So second full year, but I count it as my third year.
Okay, very good. All right. And Nicole, are you back with us now? Nope. I think
she did, Nicole.
Yeah, I think she's had to step away. So Nicole Smith is a school nurse for the Brewster School District. She and Elvia Martinez are both working. They both are full-time at Brewster. So great to have you on. And with that, we're going to go ahead and go through some forms and just some updates about the program and kind of pique your interest in what's coming up in the coming year. So I'm going to go ahead and share my screen. Okay, can you see a PowerPoint slide? Okay, very good, because I don't see it anymore. So okay, do you see slide 2? Very good. All right, and you're just seeing the slides, right? No? How about now? Okay, very good. All right. So, first thing we wanted to do is, this is our little agenda for today's meeting. We wanted to welcome Lena Kate. We want to welcome other new school nurses. So Casey's joined us this morning, and then we have other school nurses who are joining or who are going to be joining our team. Go over some of the data from 22-23 and update on where we're at with our school nurse corps district agreements. A little bit about demographics forms, the benefits that are going to be coming this year as a participant of School Nurse Corps, and a little bit about the reporting forms and our 23-24 meeting schedule. So that's what we're going to cover. And then at the end, I just want to make sure we have an opportunity to answer any questions you have about the program. Anything that's very general. We're not going to go into things today like updates from the Department of Health or updates from related specifically to COVID or how we're managing different things. We have a big agenda for our upcoming all school nurse meeting. And so this one is really just to help people get going with School Nurse Corps and the different forms and tools associated with that. So new school nurses for this school year. Well, Casey Billieu introduced herself, and nice to have her covering both Mansfield School District as well as Orondo. So she just interviewed today, and we're very pleased about that. Olivia Booker. Olivia is going to be our new school nurse. She's going to be working full-time in the Oroville School District. So she just completed her orientation program. And then we have Donica Morovic, and Donica, or Dawn, she's going to go by Dawn. Dawn is the new school nurse at the Cascade School District. So she took Crystal Claiborne's place. Crystal has returned to a clinical setting, and so that opened up that position. So Dawn will be joining Sam at the Cascade School District. So she'll be working full-time there. We currently still have, I did get an update from Warden today. They're making an offer to their new school nurse. Kimberly Hansen was in that position, and she decided to retire from that position to help her husband. And so she left at the end of this last school year, and they are interviewing for hopefully a full-time replacement for her at Warden. And Patera School District has been contracting for a 2-day-a-week school nurse position. And Elvia Martinez has been filling that position under contract from the Brewster School District. But Brewster has decided that they would like her to be there full-time for them at their school district this year. So Elvia will be covering Pateras through, the plan is through the end of September, while they begin their search for a 2-day per week RN to fill in for her. So that's our status right now. Other than that, everyone has continued on in their position. So we're very pleased about that. So Lena has joined us. First of all, I want to thank the School Nurse Corps members who participated in our interview, as well as the interview for other applicants for this position. Michelle was involved in those interviews. Debbie was involved in those interviews, and so at some of them was Sarah Kruger from Warden School District. And so I just want to thank you guys for your help in doing our interviews for this position, and we're very pleased to have Lena joining our team. So I wanted to make sure you had her contact information. So this is her email and her cell phone number so that you can reach her. Lena's actually in the office today at in Wenatchee, but she has not her first day actually starting for us on a regular basis will be on the 5th of September. So it'll be much easier to connect with her after that time. Today is fairly booked with orientation and meetings, getting her set up, and but she is very happy to help you. And she will also have some features added onto her email as far as booking meetings with her, and she'll be reaching out to School Nurse Corps nurses to see how she might assist them. Other things that her role is going to be focusing on, we'll get into when we get to quality improvements for this coming school year, and some of the things that our department is going to be focusing on here at the ESD. So welcome, Lena. We're so happy. We're so happy to have you joining our group here. So welcome, welcome. And just a reminder, because I don't want anyone to forget, and that is all the wonderful work that would not happen without Sheila. so for those of you who, and this happens all the time, you're all, we love it. We love you reaching out to us, and Sheila has just been our go-to person. So please make sure that, and of course on our webpage it says email Sheila, and you can click that link to get to her, or just type in her email. You'll want to have it handy. It's sheila.ncesd.org. And she will be happy to help you with anything from purchasing materials to registering you for conferences to helping you with your lending library needs. She's really the go-to person for all these School Nurse Corps needs. So we can't thank her enough, and do reach out to her. All right, so a little bit of review of last year and how our funding got expended for the year. Just a recap, we looked at how many hours we funded, and last year we funded over 7,000 hours of school nurse time for our region. So, you know, this is just the result of all the work that was done over the last few years to increase school nurse corps staffing. For those of you who've been involved in school nurse corps for several years, you'll remember when our school nurse corps funded hours were extremely limited. We did not have enough funding to provide a much level of support to the districts, and so much of that support was really consultative services and orientation, but not as very much funding. So this last year, we've really been able to pick up, and you can see the result in the increase in hours. Our total distributions to our school nurse corps districts was about $440,000. So that represents approximately 1 day per week for each school district. And we do cover 38 weeks of time. So this is just a reminder, the school nurse, the week or the number of weeks in the school year is really about 35 to 36, depending on your school. And we always cover 38. And the reason we do that is so that you will have paid days prior to the start of the school year. So that's just something to have a conversation about. If you don't, if you're not being given any time to prep before the beginning of the school year, you might, you know, point out to your schedulers or your supervisor that we are making sure that we provide coverage for those additional days prior to the start of school, or you could use them at the end, however you see fit. But most people prefer to use their days at the beginning of the year. So again, this represents quite a bit more funding than we've been able to provide in the past. School distributions for professional development hours. Last year, we distributed almost $16,000 for professional development. And just as a reminder, this is your professional development time that has been paid by your district. So what we do is we collect information from you about your paid hours, and then we reimburse those hours to the district. So we received altogether, out of a pool of 28 nurses, we only received 13 documents. So only 13 requests for funding last year. So we actually were left quite a bit of money on the table, about $18,000 that was not reimbursed to districts. So we'll go over that process again to make sure that everybody's clear on how they can get those hours reimbursed and what are some examples of the kind of hours that you would put on that form. School nurse stipends. So we'll talk about the stipends. Last year, we made sure that every school nurse was eligible for a $500 stipend to use for their district. That could be used in a variety of ways, whether they used it for registration fees, or they wanted to purchase a webinar, or they wanted to attend a certification, they were attending college courses for their BSN or their master's degree. We use that fund in a variety of ways. So everyone is able to apply for those, every school nurse. If you are covering multiple districts, it's tied to your district. So if you cover 3 districts, it's $500 per district that you're eligible to apply for. In addition to that, we cover your NASN registration. So that's on top of your $500. That was on top of that $500 stipend. And then we provided just additional things that school nurses had a need for that we didn't necessarily even deduct from those dollars. So that totaled $20,000. So altogether, just funding wise, we totaled about $476,000 for last year. Okay, last year's quality improvements. So this is where we're at with things that from a school nurse corps standpoint that we were wanting to track. Last year, our district assessments, we had 94% returned. So that means that we had, we look at the potential return of 31. We had 28 out of 29 schools return theirs. We were really only short one. So the only school who did not submit a district assessment for us was Stehekin with their I think they had 6 students last year. So they did not do a district assessment, but everyone else did submit theirs. So we had 28 public schools, 1 tribal school, and 1 charter school, and 1 private school. And that was St. Joseph's in Wenatchee. So very good return on those. And I appreciate everyone's work on that. All of that data was submitted up already to be compiled for OSPI to create the state report. So that part of it has been done. And one of the things that Sheila and Melly Barajas worked on this year was actually pulling our data out so that we could give you good summaries of your data. And so one of the things we'll be sharing with you, each of you for your districts, will be a 10-year overview of your district assessment data. So you can look at your trends over the last years. Now, we may get to the point next year where you might say, you know what, we don't really need 10 years worth of data. Maybe we only want to look at the last 5. So that would be great. Whatever people want, we have the data now readily available to provide to them in graphic displays that you could share with your superintendents or your supervisors. So district assessment return was good. Another quality improvement goal we've been working on for the last 2 to 3 years is school module transitions. So by the end of last year, we were about 80% with school module use. And then by the end of last year, it became very clear that school module was really going to be the way for people to go, and that the Skyward programs, the cumulative programs, were no longer going to be maintaining their immunization reports in a reliable way. So anyone who has not transitioned over to school module, we're still encouraging you to do so. If not for this coming school year that we're in right now, to certainly make that transition over at some point during the year so that you're ready to go by next year. Your reports will still be good this year, so there's not going to be any change to anything over the course of this school year, but by next year, you won't want to be putting your data, your immunization records into either Skyward or cumulative at that point. So right now we have 6 districts who are in some process right now. They may have applied for school module. They may have started the initiation process, or they may not have started at all. But we're hopeful to get everyone transitioned over by the end of this year. Our opioid reversal policy and naloxone distribution, that's another project that kind of got put on the back burner during COVID, but really we tried to step that up again over the last year. And as of this school year, ready to go this school year, we right now have 100% of our districts reporting that they have implemented their naloxone policy, and they should have naloxone in place. So if they have a policy, they should have naloxone now. And if there is any district who doesn't have naloxone, please let us know. So either contact myself or Lena and just say that you need some naloxone, because we do want to make sure that you have a policy in place and that you have the supply that you need. So that was going well. We did continue on with our OSPI School Nurse Mentor Program, and last year we were able to support 4 of our own School Nurse Corps mentors. So we thank everybody who served as mentors last year. We've continued to do trainings. We just did one in June, and we have another one that we've now added in October, and another one that we've added in June. And those trainings that we've added are open to any school nurse who would like to learn mentoring skills, whether they want to serve as a best school nurse mentor or not. If you just want to learn mentoring skills, those are great courses to take. And we're going to continue that process. And we'll have more discussions with our mentors. So we have contracts for the best mentors. Best mentors are already receiving their mentee names and contact information for the year so that they can reach out and make those connections with them. And also continuing on with our monthly roundtables to help school nurse mentors develop those skills. The 5th project that we've been working on over the last probably year and a half is the school-based telehealth project. So that project is going, moving along pretty rapidly. Our goal at this point is to, we've already identified the school districts who are going to be kind of the initial users of the equipment, and starting to run through the processes so that we make sure that we have a very clean and organized process that we can replicate for other school districts who are interested in implementing a school-based telehealth program. And so we've got some folks on the line. Jody, I think your school will be working on it. Casey, your school will be working on this. Michelle, your school would be working on this. So we have about 5 districts throughout the region who decided to be early adopters of this effort, and we're working with them right now to have at least a session with a student performed by the end of September. So the equipment's being installed, it's already being tested in the districts where it's in place, and we're already starting to develop contracts or relationships with our own local behavioral health providers who are providing the initial services. And then the 6th thing was, thank you all for those of you who worked with Melly Barajas on your web pages. There were lots and lots of improvement to school nurse and health services web pages. And I know that some of the changes are actually still coming. They couldn't all be made last year. And in fact, we've also had turnover in school nurses. And so we'll be looking again to how to promote you and your roles within your school districts, and to make sure that you're able to get information to the families and to the students that you really want them to have. How can you make your resources to them readily available, and do that through your webpage? So lots of great improvements there. And I think that about wraps up all of our what our main focus areas were for 22-23. Okay, so district agreements. So how many of you have actually ever read your school nurse corps agreement? A show of hands. Go ahead and put your hands up. You can raise it electronically, or you can just raise your hand so we can see if you've actually ever read your school nurse corps agreement. Okay, well, we encourage you to do so. So we're going to be sending it to you so that you can read it. It'll also be posted in the Google Drive, so you'll be able to access the general form. Everyone's agreement is identical. There's no difference in the content in these documents. The only thing that's different about these documents has to do with the individual schools and how they've set up their school nurse hours. So sometimes the wording might be different if the school nurse is covering 3 different districts or 2 different districts, that type of thing. Then sometimes the language on the actual form that's attached that talks about how the funds are going to be distributed to them is somewhat different. But the agreements themselves really spell out what are the district expectations as far as becoming or maintaining a membership with School Nurse Corps. What are the deliverables that North Central ESD School Nurse Corps is responsible for? So what should the district be expecting in regards to services? And it also has a list of school nurse priorities. So there's a section of it that's really designed for the school nurse to help them with priority setting from our standpoint, because in many cases, School Nurse Corps hours in the district are limited. So even for people who are in the school district full time, it's really a helpful guide to look at in terms of what are the priorities that must be met, so that it gives you kind of a resource to rely on. Also, when somebody might be asking you to do something that you don't feel like you have time to do because you haven't been able to meet the priority things, like getting your student care plans done. That would be a high priority item. You know, identifying your students with chronic health conditions and or life-threatening health conditions. That is a priority item. And it would be a higher priority than, let's say, have you had an opportunity yet to schedule out your fall vision screenings? You know, it's just how can you set priorities for your workload for things that you need to get done in a timely way, and then what are things that are actually lower on the priority list that might have to wait until you actually either have you know an increase in hours, or you have the time due to a slowdown in other things that you might be able to get to them. So I would encourage you to read your agreements. These agreements go out to the superintendents electronically for their signatures, along with their letter, you know, summarizing what they received last year, what they can expect to receive this coming school year, so that they know as well. One of the things that we send to them, as well as to the business office at the beginning of each school year, is what we call the staffing survey. And it's really, we use the staffing survey data to figure out what the school is going to, how much funding they will be eligible for through School Nurse Corps. So it's just really a simple Google form asking, how many hours do you have in your district for your registered nurse? Who is your registered nurse? How many hours are they working per week? How many hours do they work per day? What is their wage per hour without their benefits? And what is their wage per hour with their benefits? So those are the only questions that we ask of them. And we use that data then to determine, as well as other things that come up, how we're going to be able to fund them for the school year. So we often don't get them back until after the school nurses have started work, because at that point then they've determined what will the wages be, what will the hours be, etc. So we know that they're still coming in, and we look to get the agreements out and finalized by probably the middle of September, mid to late September. Those will go out to the districts. But we know that districts remain with School Nurse Corps. We're not worried about people making a decision that they want to not participate, because certainly everyone likes to receive funding to help with their school nurse hours. So in general, districts receive a day a week, whatever their day is, whatever they describe as a day of school nurse hours per week times 38 weeks. One of the things we'll be asking for that's a little bit new this year is we're going to be asking the districts to send in a monthly report of school nurse hours. So we take that data, then there's a couple of reasons we want to collect that. One is that we want to make sure that we have verification of hours in case we're audited on the use of School Nurse Corps funding. So we've relied in the past on the RN staffing surveys as being kind of that source of truth, but we know that things change throughout the course of the school year. And so we need to have a ready piece of information to show why we're providing a school with X amount of dollars or X amount of resources. And so we'll be asking them to run this. It's a simple report. They can run it right out of their Skyward or cumulative system. And it just basically gives us a rundown of hours for the RN by month. And then we can file those away and have that as our documentation proof. Okay, the demographic form. So this is a pretty simple form. We ask that people fill it out on an annual basis, or at least review it on an annual basis, and let us know if there's any changes to the information on here, because things change over time. And so we want to make sure that our records are accurate for each school nurse. We actually send this to every nurse, but we certainly want to make sure that it's accurate for every School Nurse Corps nurse. And things change. So you may have completed a degree program, and we want to make sure that we have recognized that on here. You may have joined a new state or national organization. Maybe you've joined the Washington State Public Health Association. Maybe you joined the National Public Health Association. Maybe you've joined the American Nurses Association. We want to make sure we have those numbers and that we know which agencies you're affiliated with. Sometimes we can get, if you want to register for things and use your funding, we use those numbers to register you so that we can take care of that registration fee, and you can get a discount on your registration if that's an option to you as a member. So we do ask for that information, and then certainly all your current contact information and your staffing hours and availability. It's really helpful when we do district site visits to be able to look and say, okay, I'm not going to try to schedule a site visit with you on a Friday because I know you never work Fridays. And so it is helpful to know when you're going to be in the buildings. So that is available. We can send it out electronically. And also the little link is on here to the Google Drive folder. And so you could click on this link in the PowerPoint and you could open up this as a fillable form and just quickly fill it out and then email it directly to Sheila. Okay, so for this year, what are we going to be offering? So we're again going to be covering the Snow Nassen membership. So that's about, I think, didn't change this year. It's about $155. So automatically, all of you will be receiving or renewing your memberships in Snow and Nassen. And we certainly encourage you to take advantage of that membership. Not only do you get discounts on snow conferences. So if you're going to go to a snow conference, then that is discounted. If you go to a Nassen conference, that's discounted. So there's good discounts there, but really I want to make sure you're aware of the training that's available to you and all of the resources through your membership with Nassen. It is just a plethora, a huge toolbox full of things that is available, whether it's recorded training sessions that are housed on their site, or it's toolkits full of all the tools that you would need around particular chronic illnesses. It is just a vast amount of information. And so through your membership, you can access that anytime and from anywhere. So it's a great resource for you. You should also be getting a copy of your Nassen magazine. So that, I hope, is coming to you on a monthly basis. If for some reason you're not receiving your school nurse magazine, then please let Sheila know, and so we can find out why it isn't being mailed to you. So where is it going? And then the other thing that is a benefit to you through Nassen is your Sage Publications access. So if you haven't accessed Sage Publications, you want to make sure you have your account created. You have it free. It's free to you through your Nassen membership. And we do encourage you to use Sage Publications when you're looking for specific topics, related to school nursing or nursing. You'll find, again, a wide variety of research articles as well as other articles in Sage. We'll also be covering, again, 32 hours of district paid professional development. So professional development can look like a lot of things, but mainly the main thing is it paid by your district? Because the payment is going to your district. So we want to be reimbursing them for actual hours that they paid you to do training. Sometimes training can occur in the middle of one of your scheduled days. And so you're at work and you're being paid for it. So that would be a time that you would want to record it and you would want to request reimbursement. Sometimes it's going to be on your day off, and you'd want to be having that conversation with whoever is monitoring your time card to let them know that you did training on such and such day on your day off, and to include those in your payment. Because again, we would be turning around and reimbursing the district for them at the end of the school year. So make sure that you are getting credit for what they're paying you for. Like I was describing, we ended up with a lot of funds left over because people didn't submit a request. And I'm pretty sure that you are all involved in some professional development. Another thing you can be paid for are these meetings, school nurse meetings. So here would be a first example of something that you could write on your form. You could record the number of hours we spend at this meeting today, because if you're being paid for it by your district, then you would want to be you would want your district to be reimbursed. The reason we do that is because we want you to be able to come to meetings. You know, being the school nurse in the building, you all know it's very isolating. It's just such a pleasure to be able to connect with others and have conversations with them, or hear from people from Washington State Department of Health, or hear from people from our LHJs in our region, to hear from a variety of guests, to, you know, to actually hear new information, hear about new resources. And it's difficult to do because people get busy, and oftentimes they say, well, I don't have time to do that. But we want to reimburse the district for it, so they can't, so that they're not thinking that it's cutting into your hours. If you're only at the district 16 hours, then, and you want to do a 2-hour meeting that week, then that would make, it should make 18 hours of time, so that you're not reducing your direct services hours, but you're also being paid to attend training. So we cover 32 hours. That's 32 hours per nurse. So it's so each nurse is eligible for that. And we have a couple of exceptions, so we'll go over the form so you can see what those look like, and how to report. It's really a reporting thing. It's not that anybody gets less than 32. It's really a reporting. Everyone's eligible again for another $500 stipend. So we've got the budget to be able to do that this year. We do encourage you to make all of your purchases directly through Sheila, whether it is a registration for a course or it's to buy something. It is just much easier and less time consuming for her to buy it for you than for you to buy it yourself and then have to submit receipts, and then have to take care of all of the check requests and things that have to go through, and then wait for your reimbursement to come with the next check cut. You know, so that could take, you could be waiting a month to be reimbursed for something, when you could just have her do it and it would be with you much quicker. So that $500 is out there for you, and Sheila tracks all of that, so we can keep track of how much everybody spent and what it's spent on. We do have a new resource for you. We're always encouraging you to build your health libraries. And so the new resource for the year is Advanced Pediatric Assessment. And those books are going to be, some people have already picked theirs up, others are being distributed. And we want to make sure you get that in your hands this fall, so you can add that to your resource library. It's an excellent book. Doing some updates to the lending library and what we have available to you to use in there, and then consultative services, training, mentoring, and support. So those are the same as they've been in the past. We're continuing to provide all those services. Any questions about that? Nope. Okay, looking forward to spending some money? It's always good. I would like to know of interest in this, or how many people get this already. Could you show your hands? Is anybody in here subscribing to School Nurse Digest? No, not seeing it. Okay. School Nurse Digest is a NASN publication, and NASN puts this out. It comes out, it's an electronic newsletter, so it comes out weekly, and it's a wonderful tool. It kind of has like articles in it from all around the United States of different things that school nurses are doing, includes things from Department of Health, CDC, a wide range of resources that are pulled in and compiled into an electronic tool. What we'd like to do is, before we order it for everybody, we wanted to see if anybody was already getting it, so we weren't duplicating their subscription for themselves. But we don't want to order it for somebody if they just say, I just don't want that. I don't want to have that resource. And so we're asking that everybody just let Sheila know by the 22nd of September, so that we can get this particular thing on the same schedule as NASN renewals. So every September, we'll just take care of this product as well as your NASN membership. And I think you'll really like this. I think you'll enjoy it. It's always got a lot of interesting things in it, and very applicable to what we're doing in our state. And sometimes the articles are about people from our state, and it's also information on how you might consider submitting an article and being featured in here as well. So want to know about that. So you can email Sheila if you just let her know yes or no, I want this or I don't want it. So we will limit the purchase to just those people who want it. The other thing I want to, and this has been around for a while, so it's not exactly new, but I'm not sure how many people really know that it's there. And that's the North Central ESD School Nurse YouTube channel. So North Central ESD does maintain its own channel on YouTube where you can get to different divisions within North Central ESD and view videos that they have posted. And in the past, we posted a couple of our COVID videos there. We had some orientation videos posted there. We cleaned it up this year, and the only videos that we've left on the channel at this point are really going to be our right now, the only things you'll see on there are our masking videos that Dr. Wallace made. He made one of those videos that's there when we were getting ready for COVID. But we'll be posting like a recording of this meeting will be there. Our future meetings for school nurses that start up in September will all be recorded. They're going to be housed there on the YouTube channel. And so rather than just send you links out to, trying to get you to different places where these videos get housed, we're really trying to get things very organized so that you know exactly where to go to find recordings. So if you haven't been there before, it's easy to find it. You can just go to North Central ESD, type it all in, School Nurse Corps, YouTube, and you will eventually get to it. And you can subscribe to it by clicking on this link, and that will take you right to a subscription page. And then you'll probably get a little notice when a new video gets posted there. So that's a little blurb for that. This is your 32-hour professional development report form. As you can see, it's a highly complex form. It asks for the date, the title of what you went to, and then how many hours were you paid. So it's a really, we tried to make this as streamlined a process as we could to just have a way for you to report, this is what I did, this is when I did it, and these are things I got paid for. Michelle, yes.
Will those videos on that YouTube be secured in any way? I just wonder, because sometimes we talk about things that are more maybe identifiable or.
Well, that's a really good point. The security behind that has largely been the fact that nobody goes to it and knows where it is and doesn't link to it. So that's kind of been how we have kept it from being like out in the general public where other people aren't getting to it. But I think that probably what we should do in the future is just have a disclaimer at the beginning of our meeting that states this is being recorded, and we shouldn't be having discussions about specific students or cases where students could easily be identified. Thank you. Perfect. Okay, so your 32, this form is for all of you largely who work at a single district. So if you're working at one district, then one district is paying for all of your time. And so it's easy enough to use this one form and record all of either the meetings or the professional development that you've attended. We just ask that you get it back to Sheila by June 7th, which is kind of basically the end of the school year. If you could please turn it in. That way we can make sure that these hours are included in the last check to the district. So when we determine how much a district is going to be receiving through their School Nurse Corps participation, that amount of funding is figured out for the year, and then it's divided into 3 different payments. So one of their first payments comes to them in November, and then they get another payment in the spring, and then they get another payment in July. And it's that July payment where we need to go back and look at all of the things that we might be needing to reimburse the district for. And then that gets added into their last payment. So an example of that would be this year, because of the way we budgeted our funding, what we were able to do at the end of the school year was to not only reimburse them your wage for your day per week, but we also, for those of you who are receiving benefits, we also reimburse them for all of your benefits for that day a week, which is a considerable amount. And so, and we did tell the superintendents that that was probably, you know, a one-time thing, that we had enough to do that. But what we do at the end of the year is look to see how much we are able to distribute back to the schools in support of school nurse hours. So we'll be looking for these at the end of June, you know, or early in June. We'll probably send out like one or two reminders, perhaps in the newsletter or perhaps by email, but we don't send out like after June 7th, we won't be asking anymore. We either get them or we don't. And when we have them, then we'll reimburse. We do look to see what people have put on them. One of the things that we're not able to do is duplicate payments. So for example, if you were attending something that was paid for by somebody else, by another agency or out of a different budget account, then I can't turn around and pay for it again to the district. And so an example of that might be if you were going to be serving as a school nurse mentor and you went to, you spent time with your mentee. That time would be is different. That's a different account number. It's not related to specifically to the school nurse core budget, and so those hours or that reimbursement would be separate. And so if there were things like that on this form, then we would need to take them off, because I can't pay out of one account for one thing and then duplicate it for the same work effort. Okay, any questions on this form? Okay, then we also have this form. So there.
Oh,
and this
Kathy,
applies...
I'm so sorry. I do have a question. I don't know if you saw it in the chat. Just to clarify, we can count professional development as even like these meetings or Grant County Health District meetings or something like that. It doesn't have to be specific to like continuing education, clock hours type things.
That is correct.
Okay.
Yes.
Okay.
This
Well,
is,
that
this
would
is
have very
not...
much changed mine
Yeah.
last year.
Yeah, no, this is the same as last year. Yeah.
Okay.
Yeah, it's not specific to clock hours. We're not tracking your clock hours for you. That would be
Right.
something you guys would all need to do. But this is a way to encourage you, like your Grant County meeting, Grant County Health District meetings, any of those types of meetings where your district is paying for your participation. But here's the thing, we really then don't want them to deduct we don't want that to deduct from your direct service hours whenever possible. You know, we don't want to, you know, if you're only in the district 8 hours per week and you spend 2 hours of that at a meeting, we don't want you to reduce your hours at the district to 6. Does that make sense?
Right. It does make sense.
Okay.
Yeah.
All
I think
right.
I just missed that last year. And so I didn't have very many hours to put on my form because I thought they were more specific to like continuing education reimbursement. Okay. Oh, okay, got it.
Okay.
I will make
All
sure that is updated. Thank you.
Okay. All right. Thank you.
Kathy, I have a question. First of all, just want to emphasize, if you reach the 16 or the 32 earlier in the year, go ahead and send it to me. Don't wait till the 7th. And then what if they say attend the snow conference next month? That gets put on there? I'm still kind of new at this too, so.
Yes,
Yeah,
that would get
so-
put on here. Yeah, if
Okay,
their
good.
district is paying them. So
you
if
go.
you're getting paid to be at the snow conference, this is you only want to put paid hours on here. Don't put hours on here that you say, you know, maybe your days off are Friday and Saturday and the district says, well, you can go to this conference. We're not covering you from a wage standpoint. If they're not paying for you to be there, then don't include those hours on here, because we don't want to reimburse the district for paid time that they didn't pay you. This is really for you or for the district to be reimbursed.
So then their comeback could be, well, school nurse corps will pay for this for me. If they want to get paid for their hours, that would be discussion.
These hours aren't paid to the nurse.
No, that's right. No, the school could still pay them.
Hours are paid to the district. So
Okay.
this is so what you would want to negotiate is
There you go.
to the district is, but School Nurse Corps is going to turn around and reimburse you up to 32 hours. So you could share with them, look, I've only hit 16 hours this year and I want to be reimbursed for these other snow hours. And they know they are eligible. All the superintendents are made aware that these hours are sitting there waiting for them. They'll get a report this year of how many hours they received as of 22-23. So they'll know, either 0 or however many it was that each individual district received. Now, we do have some cases where people are split between, sometimes between 2 districts. And then that would be really up to you of, well, which district is paying. You just need to let us know which district actually was paying your time while you attended training, because it may not be the same district. So these 16-hour ones are just a way to say, well, if you're splitting this between 2 districts, here's a way to do that. It doesn't apply to everyone. It just applies really to people who are being paid by multiple districts. So that's another form that's available to you. And again, if you could get those in by June 7th, that's appreciated. Okay, so $500 stipend, how can you use that? Well, you could use it in a variety of ways. You could use it for your snow or NASA attendance. You could use it, some people use it for certification expenses, for that expense. Some people use it for training registrations or other resources. And just again, we really encourage you to do all of those things through Sheila rather than independently, because it saves a lot of time and effort. I know you think you're going to be just bombarding her, and she loves it. She loves to do work for you. So please don't hesitate to reach out to her for that. Deliverables, the main things that we're looking for in terms of school nursing on our agreement. So what are the things that we're asking that all School Nurse Corps nurses do? The first one is just prioritizing school nurse activities. Use the tools that are available to you to help make sure that the district is really, you're not really being directed to do things that are taking away from your work priorities of things that you really need to get done in a timely way. The annual district assessment. So we appreciate all of you getting the district assessment done and back to us. Look for them probably around January. They should be coming to you by January. And again, we'll be asking that they be returned before you leave for spring break. Site visits, we always appreciate having letting me come out, and in the future be myself and be Lena who are coming out to your districts and doing site visits. We really love the opportunity to come out to your schools and really see you working in your own environment and interacting with your own students and all the great things that you're doing in your building. It's really hard to see any of that through Zoom, and so getting into your schools is just a real treat. And we so appreciate that you're willing to host, have us come in. And, last year we tried a variety of tools, as far as like trying to document what we were doing in the site visit. Sheila worked really hard creating this tool in, we're continuing to tweak that. We're working with another ESD who also is interested in modifying how we collect data around site visits, because these are done across the state. So any School Nurse Corps district has site visits done, and what we find is they're all done a little bit differently by each of the different ESDs. And we're really looking for pretty specific kinds of information when we come out, and we would like to have a better way of tracking that. So thank you for doing that. And then certainly the other thing that we encourage you to do is please let us know if you plan to leave your position for any reason. The sooner we know that you're leaving a position, the better, because then we can begin working with the school district on recruiting and hiring, but we can also work with you on preparation and the transition of work to another person, so that to make that process run as smoothly as possible. So if you get to the end of, like this school year, hopefully you will not decide to leave your position in the middle of the school year, and that you all stay on board. But things can happen, and sometimes people's lives change and things, if you, for some reason, were leaving, we would certainly want to know as soon as possible, along with your district, so that we can help provide some support for them. The other thing would be if your hours change. You know, if you start out in, we had a one district that started with 24 hours and that looked good at the beginning of the school year, but by halfway through the school year, really the hours had dropped to 8. So it was a pretty significant decrease in school nursing hours. And that's something that we really need to know about so that we can talk to the district administration about the school nurse core program and really what the intent of it is. We are here to provide support for them. For our goal is to increase school nurse hours. So our goal isn't to decrease, you know, to have hours decrease. It's really to help them increase. And so as they start dropping their hours, and they shouldn't because they need those hours for their health services, then we need to talk about how we or what kind of supports they need to bring them back up. Communications for this year. Well, just so you know, our regional school nurse meetings are going to be the third Tuesday of the month. They're going to be from 10 to 12, and they're all going to be by Zoom, and they will be recorded. So all those recordings will end up going into that little folder. And you'll be able to access them there. We're going to continue to do our monthly school nurse newsletters. So those will be sent out to you electronically. And then as we have updates for everything, we'll send those out as well. So any updates we get from the Department of Health or our local health jurisdictions or any other groups, we'll make sure you get those if it's something timely. We did try last year to not send so many emails and really try to, you know, if things were not time sensitive, to keep them in that monthly newsletter, because we know you get bombarded and too many emails coming in. It's really hard to keep track of it, of the information. And then certainly the expansion of our YouTube channel would be another. For our quality initiatives for this year, from a school nurse course standpoint, well, we want to certainly hope that we can get school module up to 100%. Like to see professional development, which was less than 50% last year in terms of reported hours. Would like to see that increase at least to 75%, if not higher. We're really going to be working hard this year on maintaining those great relationships that we built with public health over the last 3 years during the COVID time period. We've always worked well with all of our LHJs, and we really want to continue to be able to support their efforts in terms of public health support, particularly around immunizations. There's a lot of discussion right now, public health around naloxone and opioid response and air quality and smoke. And now we're looking at temperature, whether high or low. How are we going to manage all of these things in our school buildings? So there is, it's really important that we have these strong relationships with them. And so we'll be working on really focusing on that this next year. And certainly I would love to see more school nursing presentations at our monthly meetings. So we've already had 2 people volunteer. Michelle Rogie is going to be presenting at our first school nurse meeting, and Nicole Smith is going to be presenting at our first school nurse core meeting, and we'll be putting out their topics in the agenda so you can see what they'll be presenting, as well as other guests and topics that are coming. But we do have time built into these where it's so important that those of you who are creating all these great things for your students and making all these improvements in your programs and your processes, that you're take an interest in sharing that information with others. We'd love to have you do presentations and share so that others can learn from you and what you're doing. So Lena is going to be your go-to person for those meetings, and so she'll be putting together those agendas each month. And so please connect with her about what you would like to be presenting and kind of a time frame so that you have a spot where we can highlight you. Would love to do that. Okay, so I am going to stop sharing because I'd like to be able to see you again and see what kind of questions you guys have moving into the new school year, about anything, whether it's related to school nurse corps or anything. Like, you have no questions. I mean, what a silent group.
I'm sorry, Kathy, I do have a question. I'm sorry I was late to the meeting. What did I miss?
You weren't late to the meeting. You had a meeting, and I would have loved to have been at your meeting. Sarah Kruger, would you like to introduce yourself to the group?
Sure. I'm Sarah Kruger. I am a school nurse in 2 small rural school districts in Wilson Creek and Cooley Heartline school districts. This is my 10th year, actually. So it's been a fun ride, and yeah, I'm glad I still love my job.
And I'll tell you why Sarah was not able to join us at the start time, and that's because Wilson Creek is one of our districts who is going to be moving forward with the initial school-based telehealth program. And so she had a meeting with the Ingenium team this morning. Ingenium is our contracted vendor who is supporting this Thriving Together North Central Washington project. And so you had an opportunity to be on the line with Ingenium this morning and talk a little bit more about getting your equipment in and testing and those things. So thank you for taking that on. I think it's going to be, it's really turning out to be an excellent project. So
yeah, we're excited. We think it'll be helpful for some of our students who are having trouble getting them to services. So yeah, we're on the road. We have some work to do still, but we're getting there.
Okay, good. All right. And Susan Sloan has joined us. Susan, would you like to introduce yourself to the group? Okay, I think she's not quite with us. Okay. Any other, does anybody have any questions, concerns, things you're wondering about?
I had a question. I don't know if this is the right, I was just wondering, our district became our own district this year. And so do you know who needs to know that information? Or does that just go out somehow, like school module? Do they need to be somehow updated? Do I need to try to contact people about that?
Well, that's a really good question, Ben, because, we've always considered you your own district. So I know you kind of had this relationship with the OMAC school district, kind of, but we've always looked at you as more of an independent district. But it is interesting, we haven't really heard much about this transition. As far as school module goes, you should have your own schools. You have an agreement with Department of Health, which clearly identifies your school and who the contacts are, and you have your confidentiality agreements with your own school. But I think I'll pose that question to Michelle and see how is it being announced? How are we letting people know? I haven't seen anything about it, so I would love to know more about how that impacts you.
Me too. I don't know. Doesn't change my life.
I would guess it's a great thing. I would think I'll be good. But I'm not really sure if there's someone you're supposed to let know or about it, how it would impact others. So thank you.
I would think the business office probably would know. I can contact them and follow up with you if you'd like.
Are there any, you're all anxious to get going. So we have some of our mentors on the line. So Debbie, you are committed to be a mentor here for both Robin at Nispelum as well as Olivia in Oroville School District. Thank you. Thank you for doing that. And Michelle, you're on the line. I think we've lost Michelle. Okay, so our mentors and mentees are getting connected here. And we really appreciate all those of you who are serving as mentors. It's wonderful. And we'll have our own kind of little groupings. You'll get your own separate contracts for that work, which is a little bit different than School Nurse Corps Fund. So a little different accounting that's going on. But we do really appreciate that work. And I know your mentees love it. And Casey is one of them. So Casey, you're going to have a mentor assigned to you who will be connecting with you as well. Okay.
One other thing, Kathy.
Yes.
Just an idea, as far as presenters, I'm sure you got plenty of them, but I really appreciated that the section for the NASN thing on 10 ways to not get sued as a school nurse.
Mm-hmm.
And I don't know if she, how big she is as far as getting that down, or if we had a recording or were able to do something like that, but it seemed that was pretty useful information and gave me a good, just kind of reinforce some of the things I do with documentation and trying to be nice to people, even though you don't feel like it,
I love that. I love that. I thought that was a great presentation. I borrowed a lot of her stuff and plunked it into our orientation program because I thought it was so good and I thought it was so useful. So I'm happy to reach out and Lena will have the connection to her to talk to her about what her availability might be, or someone like her if she's not available who could do that. But I found that very, very useful. And those of you who paid for the remote NASN or the virtual conference, you haven't run out of time yet. If you didn't have a chance to listen to that presentation on the legal issues for school nurses, then you still have access to that program. So I would encourage you to make sure that you take advantage of all of those recorded sessions through the virtual conference. That was a very good one. We've also done an initial reach out to the Department of Health to do an update on concussion management. So that's another topic that's coming up. We have there's a new product out, which districts might actually, the state hasn't really decided what it's going to do with it yet, but now there's a new naloxone product that's out on the market right now. So I just really appreciate them. They went ahead and just made the exact same product, but doubled the dose. So now instead of having, two 4 milligram Narcan inhalers, you have one, and I'm not going to get the name, I'm not going to pronounce it correctly. It's something like Nexial or something. I can't remember the exact name, but it's 8 milligrams. So now you have an opportunity to have a single dose, because what they found so often is that naloxone doses need to be doubled. The 4 milligrams was not enough. And so everybody, for the most part, was almost always using 2 doses per event. And so now this company has come out with 1 8 milligram dose. So I don't know how that will look from Washington State's standing orders and what will be changing in that regard. We're kind of waiting for some updates to come out from the state related to naloxone, related to the standing orders and the fact that it's at this point it's over the counter, so you can go in and buy it. The price has been reduced. The last email that we got about it said they were reducing their price to $41 a dose, which is pretty reasonable considering that, a year ago it was 150 in some pharmacies. I don't know if all pharmacies are really dropping their price to reflect that or not. So I don't know what that price will be. But for those of you who need it, please don't buy it. We don't need to buy naloxone. We should be able to get it from any of our support teams who offer it. So in your case, Ben, it'd be from the OMAC team, right up in your area at Family Health Center. So for those of you in that area, Debbie and others in Okanagan County, I would encourage you, if you need more doses, to talk with that OMAC group. In Grant County, it would be through the Grant County Health District that you'd be able to receive your free doses. And certainly Thriving Together North Central Washington covers all 4 counties. And so they've got a supply on hand for their opioid program that they've been very generous in distributing out to schools. I did just place a new order through Direct Relief. They supplied me with quite a few last year, and then I distributed those out to districts, and I'm down to just 2 doses left. So if someone has a need right now, I do have 2 additional boxes in my office, but I did just apply for an additional supply. There's also some discussion from the Department of Health, because they have now recognized that this is becoming a problem sometimes for school districts to obtain their free naloxone. And so there's actually been a little bit of a discussion going on about, well, maybe they'll do a one-time distribution through the educational service districts where they'll give us a supply. We can then distribute it out to the schools. I don't know that you want to stockpile it, but at the same time, you know, if it's got a good long length until it expires and you need the doses, then we certainly don't want anybody to go without or feel like you are having to not be able to provide the service that you're looking for, or not be able to have it in the locations you're looking for because you have concerns about pricing. So do make sure that we know, so we can get you some doses. And we'll keep tabs on whatever the new product is and how does that fit into the scope of things. Good question, Ben. Did you want to share anything, Ben, about the meeting that you are representing our region on? Any of your work that you've been doing with that group?
I guess. You're speaking of the School Nurse Advisory Committee?
Yes,
Yeah.
yes, I am.
Well, I'm a part of that. I was asked to apply for it, which I did, and I was accepted into it. And it's basically, there's a committee with the state where after the COVID confusion with all the stuff that was come from the state level to what we were supposed to be doing, they developed this, which is kind of a bridge between nursing community and the state, so that they can kind of look through, like, the air quality is one thing that we've been looking at, and we've made help them to give an input on how they could change that up so it looked a little bit like we could implement it a little bit better at a school nurse level. So it's specific to school nursing. There's a broad range. There's a huge amount of experience in there. So I feel pretty young, but I do have a lot of experience as a nurse in lots of different areas. So in that way, I kind of have a different perspective. A lot of them are kind of at a management level, or they do like large regions like in Yakima or Tacoma, places like that. So I think it's interesting. It's kind of interesting just to see the process of how these committees, it's a slow roll, really. I mean, how they all form, and you come up with your idea, your visions, and your workloads, and just the etiquette of the whole thing, and all the way up through is an interesting process that I'm glad to be a part of it.
Good. Thank you so much, Ben. We sure appreciate you on that committee. It's so important to bring your voice in there. And Ben always speaks up. So it's wonderful to have him on a committee because he always speaks up. So I just wanted to let you know how much I appreciated that. And that really is, as Ben's describing, that's the Department of Health's effort to really create this alignment between Department of Health health efforts for school age students and school nurses. And so this consortium or alignment, whatever you want to call it, they do meet on, I think, monthly. It's a monthly meeting. And you can see part of the work that Ben's been involved in the new air quality guidelines. So the new guidelines that we just distributed in the last month, you'll see that the table has changed. Things have been simplified, less writing, so that it's easier to follow, easier to implement. And that's the kind of thing that Ben's providing feedback on, those kinds of tools or documents or guidelines that the Department of Health is creating and trying to put out and be able to implement in a school setting, which sometimes can be challenging in the past with some of the documents. So thank you, Ben. Lena, would you like to share anything with the group?
I've just been taking notes on things that you've been discussing, and what Ben just shared with us too about the advisory committee and trying to brainstorm ideas for professional development. And so I was thinking about putting a message in the chat about, please let me know what you are interested in or things that are happening that you'd like to learn more about, so I can help get that information to you and expedite it, because there's nothing worse than hearing about something and then a few months later you learn about it and then it's already old information. So want to make sure that I'm able to help you stay up to date, and just to kind of complement what Kathy is already doing for us here at School Nurse Course. So please don't hesitate to email me or message me with your things that are of interest to you. So I'm just taking notes over here, trying to come up with ideas too.
All right, very nice. Thank you so much. And Erica's asking where we can get it. I think it went out to you probably by email in early to mid-August, but we'll resend it again. It's part of a document. So it's not like it's just a piece of paper. It's more like it's part of a package.
If you go
Maybe we could even pull. Oh, go ahead, Ben.
I was just gonna say that if you go to the Department of Health website, it has it under air quality there too.
Mm-hmm.
And it you know has that color form with printed out so that your superintendent can scoff at it. Funny story. I mean, I was working on this, and we have a new superintendent here, and I was like, I've been watching this air quality. I'm like, just so you know, like this is what we're supposed to be doing, and outside it's on 151, and so I'm hearing, I got asthma kids and all these things, and I told him today it's 155, and he's like, well, I'm outside, and it doesn't seem that bad, and it just rained, and I mean, it's every 5 minutes it's updating, and I'm watching it climb, and I'm just like, okay, this is exactly the fight that it's going to be that I was thinking it is going to be, is that it doesn't look bad and nobody's ever thought it was bad, but it turns out it's been bad the whole time.
Mm-hmm. Yeah, invisible. It's just kind of until it gets chunky and you can actually see it. All right, Nicole, we can see you now. Would you like to introduce yourself to the group?
I have been here and I introduced myself in the beginning, so I'm confused.
I think I didn't see your camera on. I think that was why it was, but now I can see you. Oh, I think we're frozen. Okay.
My introduction, if you would like.
Oop.
Anyways, I'm Nicole, school nurse in Brewster, and I've been here since the start of my 5th year.
All right, thank you so much. I'm sorry, we're just having some technical breakup here, but that sounds good. Thank you. All right, so with that, we're at the end of our time. So it's about 11:30, so we're going to log off. I thank all of you guys so much for being part of School Nurse Corps. we can't thank you enough for all the work that you're doing, truly. I know this is a really busy and hectic time for you to, get started. We just wanted to make sure you were aware of some of these forms and documents and processes, and you had a chance to see what the program was about. And we'll just move forward from here with our next official full school nurse meeting. The first will be September 19th, and that's the third Tuesday. So and that is the one where Nicole and Michelle will be doing their presentations on their quality improvement efforts, and there'll be other guest speakers as well. So looking forward to seeing you then. In the meantime, we'll get this posted over onto the YouTube channel and just keep moving forward. All right. Thank you all so much. Looking forward to seeing you again soon.
Thank you.
All right. Bye-bye.